and welcome back. It is The Real Story with Jeanne Ives. And our phone number here, 312-642-5600. Well, the other day I was watching TV. I don't do a lot of it, mainly news programs. And I was watching Fox. And sure enough, a Fox local commercial came up. And it was for State Representative Maura Hirschauer. She's a Democrat running in the West Chicago Bartlett area. I was like, wow, you have a streaming video on Fox? Now, I mean, those can add up really quickly. Before too long, you're spending a lot of money. And I'd also noticed that she's playing radio ads on the streaming services, including AM 560. AM 560 is conservative talk radio. What is this absolutely progressive liberal Democrat running radio ads on AM 560? I mean, great. They probably want the revenue. No problem. I mean, they can. That's fine. I'm just like, where are you getting your money from? So I started to look because, and here's what I found out. 18 months ago, she had a negative account balance in her campaign account filed with the State Board of Elections, a negative campaign account balance of about $1,700. In the subsequent 18 months, she has taken in $258,571 from the Democrat Party or other Democrat, like House majority parties. Democrats, the Democrat Party, $258,571. And in the span of 5 weeks, no, I take that back. I'm sorry. Yeah, she has taken in $264,000 from the unions. Let me say that again. Since 4/1/23, so April 1st, 2023, she's taken in $264,000 from the unions. Since August 16th, 2024 to 9/20/2024, September 20th, 5 weeks, she's taken in $258,000 from the Democrats. Over $500,000 has gone into this small little state rep race. She's running for the third time. She's progressive. She's the one who votes for, decriminalizing fentanyl. She's the one who's voted for her own pay raises, bloated budgets, you name it. Comprehensive sex ed. Just, I can go on and on. Non-citizens can become police officers. All of it. She votes for all of it. And she's got more money to tell people about what a great mom she is. And she's doing something about gun violence. Well, you just heard from Sean Morrison. Gun violence in Cook County? They're letting the gun offenders out on electronic monitoring, and then 74% of them aren't showing up. Failure to appear. That's what's happening. You have a lack of enforcement. You don't have a lack of rules. But she's out there on commercials making people believe that she is somebody she's not. Well, I mean, you know what? Well, you know what the General Assembly needs? It's on life support, and it really could use a doctor. Unfortunately, there's one. There's a doctor in the House, and his name is Dr. Bill Hauter. And he joins me right now. He's a physician from Wharton. He graduated from the University of Illinois College of Medicine. And he did his residence in emergency medicine and anesthesiology at Indiana University. He's board certified and actively practices. He's not only a state rep, he's an active practitioner with OSF St. Francis Medical Center in Peoria. So we're really pleased to have him on. Bill, thank you so much for joining me.
And great segue into that. I ran a little bit of, I had a slogan, put a doctor in the house, and you're so right. I mean, it's nothing more than just, it's very sick what we're facing. And at times it's some of the ideas, I call it working in the stupid idea factory. Mm-hmm. It's just one stupid idea after another. So yeah, thank you for having me.
Well, it's really, it's just so great to talk to somebody who's actually in the systems that they make policy decisions about. But do you feel like you're listened to when you're in committee and you're talking? I mean, you're on the healthcare availability and access, healthcare licenses, prescription drug affordability, which we lowered prescription drugs for everybody. That's all they're saying. You're on the public health committee. Do they listen to you?
Well, I think they do. I mean, a lot of them are well-meaning people, and some of the issues, many of the issues, in healthcare are bipartisan issues. So I think they respect my perspective, and it is good being the only physician in the whole General Assembly because, like I said, they're well-meaning, but they don't understand the realities of medicine and how it's practiced and how it's paid for. And so I can bring that perspective of the actual reality of medicine. And so I think that is needed and respected and impactful.
So one of the things that I did want to have you on and talk about is the fact that, it's going to be probably close to $1 billion in non-citizen health care that will be given out to folks that are residing here and they're not citizens. And they're going to be going into, they're not in a Medicaid program that we do not have a cost sharing agreement with the federal government because they're non-citizens. And apparently this program, correct me if I'm wrong, is much more beneficial for non-citizens than Illinois Medicaid is for the disabled, the poor, people who it was meant to be used for.
That's exactly right, and that's what's so frustrating, and so actually, just I consider it so exasperating that we would put vulnerable Illinoisans, behind illegal aliens, not even citizens of our state, not even citizens of our country, that we would put them in front of our citizens, our veterans, our disabled, and what they have done is they've created a system where there's so-called, initially there was no managed care part of it. And, with a managed care process, you get denials of care, you get step therapy, you get, pre-authorization abuse and all these things that you get and that we have to deal with in the Illinois Medicaid system. With the undocumented or illegal alien health care, however you want to put it, they were not in any system. They received basically fee-for-service golden health care. Since then, they've tried to, because of the outcry that we've raised, they've tried to put it inside of a managed care process where there is some management of these benefits, these golden benefits to people who should not even be in our state or in our country. So they've tried to initiate some boundaries and some restrictions and some managed process, but they're having a hard time doing that because, they let the cat out of the bag. And now these people, to try to claw back their benefits, it's very difficult.
So when we talk about it, I've talked to doctors before about this Medicaid issue back when I was a state rep, and they say, look, we make no money on Medicaid. Is that still the situation? Oh, yeah.
We lose money on, every patient that's in Medicaid or Medicare. And we survive only because of the private health insurance process. But even that's becoming more and more difficult. There's a real disaster coming to the payment systems that we have. But we can start by not paying for people that should not even be in our state.
Absolutely. Just think about that, folks. Your non-citizens, illegals that have come into the citizens are getting better health care than our veterans and our disabled and the most vulnerable among us. That is a travesty. One other thing, though, is how about the resourcing of this all? For example, in Peoria, are you seeing emergency rooms that can't service everybody there? Are you seeing illegals in Peoria as well come in and use services and crowd out other folks?
It's difficult for me to say that because okay. I don't see that. I don't see that the big picture. I take care of individual patients and I don't really look at their insurance. But on a statewide level, it's absolutely happening, mostly in Cook County, obviously.
Okay, and one other thing that I wanted to talk to you about before I let you go, because I also found this alarming, and it had to deal with a parent's ability to get access to medical records. And also what you can and cannot, what you have to have permission from parents on and what you do not. And in a previous conversation, you essentially said that whenever it comes up, when it's something related to birth control or anything that deals with sex, that essentially that's one area that you don't have to ask permission to talk to a parent about for a minor child.
Yeah, I mean, that's another area. My wife is works for a pregnancy center, pregnancy care center, so-called crisis pregnancy center, which is how most people refer to it. But, so she, as a nurse and the nurses at the center would have someone that would come in for any kind of treatment that was a minor. You would have to get permission from their parents for any kind of treatment. I mean, even a pregnancy test, Jeannie, you'd have to get permission for a minor. If she came into an abortion clinic, there's no permission needed. If she came into the emergency department and she was a 14-year-old and she was with a 28-year-old guy and he came in and brought her in, we cannot ask any questions. And he wanted her to have, a pelvic exam to see if she, or whatever, to see if she was pregnant. That there is no anything related to reproductive health, quote unquote. I hate using that term. Mm-hmm. We cannot ask any permission. It is totally up to the minor to direct their care. So that's how crazy it has become with anything related to pregnancy care, abortion care, and a minor. They don't have to have any oversight. So you can see that's just ripe for abuse.
And is that state law or federal law? Is that what's coming in over there?
That's state law.
That is a state law.
Absolutely
that's a state law.
Yep. Mm-hmm. That's absolutely state law. The state of Illinois, you cannot ask any if it's birth control related or sexual abuse. You cannot ask questions or permission.
Well, Maura Hirschauer, she's a mom. She cares about children. That's what her commercials tell me. She cares about children. Yeah. She touts herself as being just a great mom. Yep, that's all these Democrats. That's what they say, and it's just absolutely 100% not true. The opposite is true. Hey, Bill, we've got to leave it there. I want to thank you so much for spending some time with us and explaining these really important issues, so that others are more informed about what's going on in the state. And I really appreciate having you in the house.